Hi, hope you are well. Today's lesson is about the pericardium, a fibroserous sac which encloses the heart and great vessels, the pulmonary trunk, the ascending aorta, the lower part of the SVC or superior vena cava. It's located in the middle mediastinum or middle part of the inferior mediastinum, and as I said, it consists of two components, including the fibrous pericardium or fibrous layer and serous layer. Here is the fibrous pericardium and here is the serous pericardium. Remember that the serous pericardium consists of two layers. Its internal layer is attached directly to the heart and is called visceral layer, while its outer layer attaches to the internal surface of the fibrous pericardium and is called parietal layer. The fibrous pericardium lies in the middle mediastinum at the level of R2 to R6, from R2 to R6, and anteriorly is related to the sternum costal cartilages from R2 to R6, and also is related to the pleura and the thymus. As you see, the lower part of the thymus is located in front of the pericardium. Okay, so remember that the fibrous pericardium anteriorly is related to the sternum, costal cartilages, pleura, and lower part of the thymus. Posteriorly is related to these structures, is related to the descending aorta or thoracic aorta, is related to the esophagus and to the bronchi. And laterally, the pericardium, the fibrous pericardium, is related to the lungs, and pleura is related to the phrenic nerves, and also is related to the pericardiophrenik arteries or pericardiophrenik vessels. Here is the pericardiophrenik artery. Pericardiophrenik artery originated from the internal thoracic artery. As I said, the serous pericardium consists of two layers, including the visceral and parietal layers, and as you see, there is a space or a cavity between two layers. This space or this cavity is called pericardial cavity, containing pericardial fluid. The pericardial cavity has two recesses or two sinuses. One sinus is located among the pulmonary veins and is called oblique pericardial sinus or oblique pericardial recess. It's also called Haller's sinus, another name for oblique pericardial sinus, and as I said, is located among the pulmonary veins. Yeah. The second sinus or recess is the transverse pericardial recess, located among the great vessels, and here you can see the finger within the transverse recess, which is also called Thiel's sinus or Thiel's recess. As you see, this sinus, the transverse sinus, is located behind the pulmonary trunk and ascending aorta and in front of the SVC or superior vena cava. The pericardium is supplied by several arteries. It's supplied by the pericardiophrenik arteries, is supplied by branches from the descending aorta or thoracic aorta, and also is supplied by branches from superior phrenic arteries. Here are the superior phrenic arteries on the superior surface of the diaphragm, originated from thoracic artery, and as you see, branches from these arteries supply the pericardium. Its venous blood drains into the azygos, and its lymph drains anteriorly to the paraesternal lymph nodes and posteriorly to the para-aortic and paraesophageal lymph nodes. Inflammation of the pericardium is called pericarditis. Pericarditis, which is accompanied by pain, a sharp pain behind the sternum, and this pain is more severe when lying down on back and on left. In pericarditis, the pericardial fluid may accumulate excessively like this and compress the heart, in particular the thin-walled atria, and interfere the filling of the heart during diastole. This condition is called tamponade or cardiac tamponade. Here you see the heart in a normal chest X-ray. Here is a chest X-ray, a normal chest X-ray, and here you can see the heart. Look at the heart and compare that with this one. In this chest X-ray, you see the heart like a bottle, water bottle. Yeah. So remember that the water bottle sign in a chest X-ray may be due to maybe due to pericarditis. This extra fluid or extra pericardial fluid should be drained using a syringe like this. This procedure is called pericardiocentesis or paracentesis. It's also called paracentesis. The needle can be introduced to the left costoxiphoid angle. Here is the costal margin, yeah, and here is the xiphoid process of the sternum. Between them, we've got an angle. This angle between the costal cartilage and the xiphoid process is called costoxiphoid angle. Here is the right costoxiphoid angle, and here is the left costoxiphoid angle. Remember that the needle should be inserted through the left costoxiphoid angle at an angle of 45 upward. If the needle is inserted perpendicular to the trunk wall, it may enter and damage the liver. So remember that it's important to insert the needle at an angle of 45 upward.